Hi, gang. It's Lori Eldred with Just a Social Worker podcast. And I wanted to follow up this episode based on the last episode I did, which was episode 6, where I talked about the death of a social worker in California who was unfortunately killed by a client who was experiencing a mental health crisis. That social worker, Alberto Rangal, was killed early December. And since that time, many of his colleagues have been rallying to create change within the larger San Francisco healthcare system to keep themselves and others safe. And even as I wrote the script and thought about framing and recording this conversation, we had another social worker that was killed this time who worked in the VA. Nick Cruz was working in the Jasper VA clinic on Tuesday, which was about a week ago, when a client or at least a member of the Veterans Bureau walked in for a mental health consultation and unfortunately killed that individual. Even with these two deaths happening in pretty quick succession, I just want to honor both of their deaths, know that they are tragedies that were absolutely preventable. And also to follow up on what has happened in San Francisco since the death. And I will continue to report on the other social worker and maybe things happening there based on his death. So thanks to Google Alerts, I found a follow up I want to share with you on a survey that was done of the union membership in San Francisco, which includes social workers as well as other healthcare staff. 120 out of 190 people surveyed completed this survey, with a 63.2 response rate. So, just kind of as a side note, generally response rates are not that high. So, I think that in of itself is probably telling leadership something pretty significant has happened, and really might speak to that pressing need and alarm of the murder that they witnessed, heard about, or were exposed to of their coworker dying. So I'm going to read you a little bit about that survey and some main points I pulled from it. So the survey found the 120 people who filled that out have experienced unsafe working conditions, including violence, sexual harassment, or general harassment. And that was 90%. So 90% of those 120 folks reported some type of unsafe working condition. 90% also reported experiencing some type of threat, assault, or intimidation on the job, which was either verbal, physical, or sexual. 83% reported witnessing patients being threatened, assaulted, or intimidated in the workplace. 86% reported witnessing colleagues being threatened, assaulted, or intimidated at the workplace. Only 5% have said they have not witnessed any type of harassment on the job. So that's only a few people within the 120 that completed this survey. 81% reported feeling unsafe at work at least once per month, and 90% reported this to management. So this is an issue getting reported to management. I'm not sure then what is happening between management and upper level management or management and agency, CEO, CFO, staff. It also found 50% of respondents had been sexually assaulted or harassed at work, and 40% had been, so probably about 50 or so people had been attacked at least 4 times. 60% said they had been stalked or intimidated. 85% had been threatened with violence. This article that I wrote, and I'm going to put that in the show notes as well, also cited a 2020 US Bureau of Labor and Statistics that reported healthcare and social service workers were 5 times more likely to experience workplace violence, and healthcare workers accounted for 73% of all non-fatal workplace injuries and or illnesses from violence in 2018. So when I say healthcare workers, they also within the healthcare space include social workers. What I don't see is the US Labor and Bureau of Statistics. I did a kind of short search. There is no specific information as related to social workers, although I have seen something floating around that the social work profession is in like the top 20 of all working professions. We're in the top 20 in terms of risk of assault, death in the workplace. Again, I'm going to put a link to that um, the US Bureau of Labor and Statistics. I'm going to put a link to that information. So here are some of my thoughts based on this article. Thank you, Google Alerts. I think it's really hard to see these numbers in print and the level of exposure in this particular healthcare system. It's staggering. I also find this is probably fairly spot on when it comes to our field and the exposure social workers have to violence that they've experienced in the past, are experiencing even now as I record this episode, and will continue to experience in the future in our field. I'm not surprised by any measure that management was fairly aware of the problem, yet chose not to act on it. I know we typically see what feels like these one-off situations, and I listed just two of them, and I am in the process of starting to compile a more comprehensive list of information on social workers that have been injured or killed within the workplace. I think what we see are these really tragic situations, and this survey is probably one of those experiences that we could probably maybe generalize. I know it's not our whole entire profession, but I think it's a bit of a red flag in terms of what is going on in our field. So we do see these one-off situations that end up in the news, but it often doesn't turn into a long-term rallying point. The social work profession does not do a good job understanding the level of violence and trauma exposure in the workplace and how that impacts us. I have to think this amount of exposure is going to show up personally, and no matter or no amount of self care is going to mitigate it. I'm also really happy to see there's a union amplifying the voices of its members, but sadly, it's probably not the case for all of us. Lots of us in the social work profession also belong to unions, and some of those do a great job calling attention to these very issues. Not every workplace, though, has a union which can organize and call attention, and that's another sad reality of our profession. The bottom line is none of this is acceptable. None of this should be seen as this is what you get when you signed up to be a social worker, and it should never be tolerated. We need more research into this area of our profession, and we need more system work, i.e., policies, practices, and supports to work on reducing violence in our workplace. Without it, we do not cope and function well, and it leads to some real and understandable workplace shortages. It leads to some real and understandable negative impact personally and professionally. And it really just systemically impacts in a negative way the larger community. So going back to that 2018 US Bureau of Labor and Statistics, which is again linked in the show notes, it indicated that workplace violence is an issue in healthcare. Healthcare workers, including social workers, are 5 times more likely to have a workplace violence injury than any other profession. So all worker industries are about 2.1 people per 10,000. Healthcare is 10.4 people per 10,000 full-time workers. And so looking at some of the charts provided, there is a clear indication that violence in the workplace has been on the rise. It also reported from 2011 to 2018, there were 156 workplace homicides to private healthcare workers, with about 20 per year, and we've already seen 2. So other articles indicate that workplace violence is often unreported to supervisors, and maybe the incident in California is an indication of why. When supervision is told, management is told, not much happens. This has been my experience professionally, and has really happened in a way that's sending really harmful messages about the risks of the job, but no real work to have policies to protect staff. This report also does track threats of harm and harassment, and those rates for healthcare workers is even higher, about 13, almost 14%, with the number rising fairly quickly over the past few years due to COVID. So, violence in the workplace is a problem, and the other problem is the lack of accountability on the behalf of workplaces to address these issues. While guidelines are out there to encourage workplaces to have strategies in place as well as ways to report it, I'm not sure that's happening. So just kind of ask yourself and your friends if you know how to report violence and threats, and even if you feel safe enough to do so without the fear of retribution, right? Ask yourself, what are those ways that we're expressing our concerns? How are our workplaces tracking that? How are they following up? How are they monitoring for trends? And I will probably take a guess that they're not doing a great job. So I just wanted to shoot this really quick episode on a follow-up to episode 6. I'm going to put all of these links in the show notes. And as ever, please follow me on LinkedIn under my name, Lori Eldred. The same goes on Instagram, or you can follow me on Instagram at Just a Social Worker Podcast. I will have all those links to the show notes as well. Hopefully you're being safe out there. Get a buddy, tell your supervisor, do some check-ins. Let's take care of ourselves, and let's do that well. Until I talk to you next time. Bye.